The final section is on communication and providing you with some key resources so you can walk away using your voice or pen to advocate for patients. Now, one of the first questions is, why are we leaders and being called upon to be part of this conversation? And it's because we are leaders and we have a vital role in communicating. We use our talents every day in our emergency units and communities, talking with patients from all walks of life. Some patients live in urban areas, others live in rural areas. There are some who are experiencing homelessness, others who have disabilities, very young, very old, some with no or very little education. We have to make the complexities of medical care understandable to them, and we have to challenge ourselves to communicate better so that they understand complex disease processes. In the same way, climate change needs communicators. We have a message and we have to communicate to policymakers, non-governmental organizations, scientists, media, and the public. This is a very important role, and we have a unique opportunity within our space to talk about many climate change risks as it pertains to health. This is one resource that I really like. I encourage you all to explore. It'll be made available to you after, A Guide to Making Your Science Matter, Escape from the Ivory Tower. Dr. Jonathan Patz has used it after he conducts scientific research in order that he's better able to frame his message and the key points for media audiences. This is just one example. It says climate change is triggering disease epidemics. And then you sketch out, what is the problem? Why is it important? What are the solutions? And what are the benefits? Having this framework readily available can help us better practice and articulate the impacts of our scientific work and research. Others have issued key points that should be addressed and considered when communicating climate. This is 15 Steps by Eco America. The report will be made available to you, but here are a few recommendations. Start with people, stay with people. Why is this important? For people, for each other. Well, we're all at risk. Some people are especially at risk for adverse health effects. Connect on common values. You know what those values are best when you're talking to members of your community or some of your colleagues. Acknowledge ambivalence. Not everyone's going to agree on the same thing. Make it real. Emphasize solutions. If 2020 has primed us enough to doom and gloom, we have an opportunity to find the silver lining in many ways. And there are a lot of really exciting solutions available. Nobody has the solution, but we have several solutions that we can implement. Inspire and empower. Remember that you're leaders. As leaders, you have a real opportunity to impact younger audiences and youth who will be impacted throughout their entire lives by increasing climate variability. Focus on personal benefit. Describe, don't label. Have at least one powerful fact from a trusted messenger. A trusted messenger. Who is a trusted messenger? You are. We as health professionals and scholars within our academic communities are trusted messengers. We have heard about it during the coronavirus pandemic, but many of our patients, our colleagues, our friends, and our communities rely on us. So be that voice, and then ditch the doom and gloom. Again, focus on the solutions and stay positive. This is another guide to effective climate change communications. It's many pages long. You can feel free to peruse it after this workshop. And then one other component I want to reiterate is it's a partnership. And as partners in health, there are some non-traditional scholars that we have an opportunity to partner with. Those are journalists, meteorologists, and scientists. Within your community, you may be the only emergency medicine physician, nurse, midwife, researcher who is interested in the intersection of climate and health. As such, it represents an opportunity to get across sectors and collaborate with others. These are just a few examples. I actually had the opportunity to talk with Hope a few weeks ago, who's a journalist, talking about rising waters at Lake Victoria. This was just one of her many articles. And she's working to improve science and journalism relationships within her community. Her and her colleagues have started the Science Cafe, which brings together scientists and journalists to empower action and engage in discussions. Meteorologists are another voice of science and climate science. This was one article. They said, Africa is the lightning capital of the world. And so how can you share in the same discussion with your community on risk? We as emergency medicine physicians understand risk very well, and risk of health and disease for our patients. So in a similar manner, meteorologists have to communicate risk to diverse audiences. That comes down to early warning systems and better communicating to all patients and all members of your public in your community. And then the third one is scientists. These can be environmental scientists, social scientists, and many others who help inform change. So how do we take, for example, technology that environmental scientists uses to measure dust storms and use it to benefit human health and reduce disease? This is one example in Uganda just from the last year where they trained over 1,000 journalists reporting on climate change. Who's going to talk to them? You can have a real impact communicating with journalists who can help promote and expand your messages as a trusted messenger of health. Again, to reiterate, there's this interconnectedness of risk. Risk is understood as the potential for consequences where something of value is at stake and where the outcome is uncertain. We have all felt the risk this year and the uncertainty related to COVID, of our jobs, of even this conference and having it to be able to be changed to completely virtual. It can be really comforting to collaborate with others on risk of climate and extreme weather events, just as an example. And to develop meaningful policies and allocate resources, it is essential that decision makers understand the inherent uncertainties and address the underlying processes, interconnectedness, and complex vulnerability of people and systems. Next, I would like to share 3 key resources with you on climate change communication. Now, there are many around the world, and so this is just an example, but hopefully you find them helpful as you explore your own interests in coming weeks to months. The first is George Mason University's Center for Climate Change Communication. Professor Ed Maybach has been studying and working on climate change communication for years. He'll say simple statements repeated frequently are most impactful. And so I'm going to step away just for a minute and go to their site. So this is the George Mason Center for Climate Change Communication. You can see here there are various reports. They have them down here via polls, why it matters, newsrooms, and it's media that we traditionally wouldn't engage with. So you can go to journal articles or presentations and learn about how you can communicate better and see some of the work of Professor Maybach and others. George Mason University on why Center for Climate Change Communication has these 5 key points. Climate change is real. Climate change is caused by human actions. Again, anthropogenic climate change or human caused climate change. Number 3, more than 97% of the experts agree. Number 4, climate change is harming us. Number 5, we can solve this problem if we work at it. This is particularly important when it comes to informing people who are less supportive of climate change policies. The second program is Yale program on climate change communication. So I'll step away again. And so here you can see the Yale Center. They talk about various audiences, behaviors, beliefs and attitudes, climate impacts, messaging, policy, and politics. Certainly this is a little bit more US centric, but you can get some key points depending on what your interests are. You can also see how they use visualizations and data to inform the public on and increase their own awareness. You can see these graphs, fact sheets. They even have them in Spanish. And so based on your interest and expertise, it can be really helpful. And then the third one is Climate Nexus. I will bring up, let's see. Climate Nexus, as you see here, they have key issue areas and their focus is engaging on climate change impact and issues as well as with the media. So they talk about energy, food, science, health, and even the private sector. And so it can be a great way to partner with some of your business and investor colleagues on these issues. They do have an international section on international cooperation, again, talking about the Paris Agreement and climate action, as well as the Intergovernmental Panel on Climate Change. And then I really like the communication basics section. And so if you're new to writing an opinion piece or talking about climate change, the myths, do's, don'ts, this can be really helpful to just explore. And then even best practices for talking about climate change and cyclones, how to talk about climate change in our given political environment. So various opportunities there depending on your interests and avenue to explore. So that's a lot of information, but hopefully it gives you some tools to walk away with so that you can better enable your own interests and really define climate action for yourself. Now, sometimes the task may feel too big, some may feel too small, but I encourage you all to find the one that feels just right for you based on your given time frame and opportunities available within your community. There are a couple other resources to help you expand your voice. The Op-Ed Project is an international program where you can sign up for training and also resources so you can write an opinion piece for newspapers, magazines, newsletters. There are scholarships available for the core workshop, Right to Change the World. I actually had an opportunity to take that back a few months ago, and I really found it useful in exploring how to articulate some of the things I wanted to say to public audiences. Again, getting rid of our medical jargon and trying to write in a voice that people can understand. They also have webinars. You can pay for what you can and join. The link is there. And then there are a lot of free resources online. So if you want to practice pitching to a certain newspaper, for example, it gives you a template and an outline of what to do. The National Institute of Environmental Health Sciences has a climate change and human health literature portal. There are international scholarly articles in here, but it's a really nice way to get a flavor for what people are writing about when it comes to climate change and health research and scholarly output. You can just log in, it's free, and then explore based on geographic region, based on specific health impact or topic. there are several different filters that you can use. And then collaboration, certainly not now, but one day soon, we'll be able to be in person and meeting partners around the region and around the world. And so these are just a few examples. The United Nations Climate Change Conference, COP26 is upcoming next year. So that's a really important one. And we need you at the table. We need all of us at the table in order to develop solutions and to advocate for our patients within our own countries and regions. The Consortium of Universities for Global Health, another important player, and then Planetary Health Alliance, talking about planetary health and the role we can play. Again, we talked a lot today, but it comes down to knowing the climate science, education, and advocacy. You might be able to use your voice across all three of those. You might choose one, or you might choose something completely different. It's up to you, but there are a lot of solutions available. As just one example, you can look at solar costs. So solar costs dropped by a factor of, let's see, I can't see, 5, by a factor of 5 since 2010. And so knowing the climate science, why do we need solar and why and other renewable energy rather than fossil fuels is really important. Educating people, again, not only educating each other, but diverse audiences and why this may be important to them as an industry or an organization. And then the last piece is policy and advocacy. How do you make change happen? And we can use our skills in writing and our voice to advocate, giving testimony and engaging with our ministers of health, for example, to make this happen. So the last question is, what will you do? What will you do? And I hope we gave you some ideas today. And I just wanted to leave you with one final piece of advice, if I can. But ultimately, you can build off your why. Why did you show up today? What do you want to accomplish? And how are you going to make it happen? As we bring ourselves to a close, I want to thank you all for your participation today in this workshop. It makes me think and pause. We started out why we are here, why we're investing time despite our busy schedules, a global pandemic, and patient care. I think about our families and our friends. I think about the global burden of disease and the impact we can make with the visions we created today and our dialogue. For we have an important role, a vital role in shaping our future. We can create a new reality and a new vision of health and well-being within our emergency units, within our health systems, our emergency care systems, our communities, our regions, our countries, our island nations. We can change the dialogue on climate change and human health on our continents, on every continent, and across the world. For as we've seen with the novel coronavirus, the planet doesn't seem so large. And perhaps we're more connected now than we ever have been before. And so it gives me great enthusiasm and excitement to be able to partner with colleagues, researchers, industry, academia, non-governmental organizations, governments, in order to create a new ethos of climate change, one that includes health and well-being for each other, of justice, and of access to care. All right, and just to round it out, the global burden of disease, Many health systems are not prepared for the rapid transition from disease burden dominated by communicable, maternal, neonatal, and nutritional diseases causes to non-communicable diseases, and we must adapt. This is the most recent report, The Global Burden of Disease by The Lancet. Enormous opportunity. I looked for, disability adjusted life years. How can we reduce that? How can we get healthier people across every continent? Enormous opportunity. I'm just looking, this was a commentary, why sub-Saharan Africa might exceed its projected population size by 2100. So there's almost 8 billion people on this planet. How are we going to protect them and each other? How are we going to manage a growing population to ensure everyone has access to resources and infrastructure that allows them to be healthy? How are we going to protect them as emergency care professionals? And then looking at the leading causes of disability adjusted life years for all ages. Again, this is from the most recent report. Look at them: neonatal disorders, ischemic heart disease, stroke, respiratory infections, diarrheal diseases, chronic obstructive pulmonary diseases, road injuries, diabetes, back pain, congenital birth defects, infections, depressive disorders, headaches, lung cancer, chronic kidney disease. There's so many opportunities where climate change intersects with pathology. It's a real opportunity for us to address the leading causes of disability and harm to patients. So just to end with key resources, here we shared a few on education, and then our climate change and human health literature portal. You have access to the climate change communication resources as well. And of course, the Lancet Global Burden of Diseases. We'll share these materials with you after. And it has been an absolute pleasure. We started the day talking about climate, health impacts, and emergency care. Then we transitioned to climate smart healthcare and how we can support environmental sustainability in healthcare and build resilience against extreme weather events. And we concluded in session 3 with empowering action, giving you a few tools and resources so that you can expand your voice and your education to move forward. The reality is, you know enough. There's always more climate science to know, more literature, and more things that we all could know. But the reality is, we know enough, and now we just have to act. Remember, emergency medicine, all people, anytime, any concern, vulnerable populations are at risk for adverse health outcomes. You have to be opportunistic and maximize local, national, and global partnerships. Sometimes that includes professional organizations, just like we are here today. Use your communication and leadership skills outside the office, wherever that may be, and whatever defines office for you as you practice acute care. And then develop your climate and health lens to advocate for patients. Today was just the beginning, and you can continue to expand upon that. We'll now begin discussion 3.